developed infection prevention and control greatly in the Trust. There has been board-to-ward support and increasing clinical support as we've gone along the years. We first had MRSA in the Trust around the year 2000, and then we moved on a few years, and then we had C. difficile, Clostridium difficile, like the rest of the NHS. So we've already faced some infection control challenges in the past. However, COVID was a different challenge completely when it occurred in 2020, because it was a virus that was spreading so rapidly, and the control method was known to a certain extent, but we had to work on a lot of systems that we hadn't previously concentrated on, such as ventilation and other aspects of infection prevention and control, such as the use of PPE, FFP3 masks, and so on. So we've learned a lot over the years as an infection control team about the usual methods of infection prevention and control, ranging from hand hygiene to isolation and to good infection prevention and control practice. However, with the onset of the pandemic, we stepped up, and I'm really delighted to say that we had support from our clinicians, from our managers, and the whole hospital got together and we created the infection control cell, which is an expanded version of the infection control team, and we will talk about that in detail as we go along. But the amount of teamwork that we had was unparalleled, and I think the future we will be building on that teamwork. We will be building on all the system methods that we created during the pandemic, and I think it will hold us in great stead, because the future really is about being able to manage global viruses that could be transported to the United Kingdom because of the increase in travel, and also because there is a lot of movement of people, and therefore we have to expect the unexpected in the future and be ready for it.
The immediate changes at the beginning of the COVID pandemic really was around the use of PPE, particularly at first in our ED department, because they were going to be the first responders, if you like, when people come through the door. So it was a challenge to make sure that the right staff were trained, because we had small groups arriving down in ED, but they were obviously working at the same time. So there was always that feeling of, are we showing enough people what PPE should be used? And there was a time when we were expecting staff to wear full PPE, even with patients that weren't on requiring respiratory support or other forms of, say, ventilation. So that was difficult. We also had the arrival of respiratory hoods for patients, for staff that can't be fit tested. And enormous boxes arrived in our office, and we had to assemble them all and make sure that they were functioning so that our staff are safe, ultimately.
So I'm just going to talk very briefly about the arrival of the COVID-19 pandemic. So as we knew it then, it was coronavirus, and we obviously were very aware from everything that was out there in the media, in the news, the impact on China, and then gradually how this became a global issue. But I think it took some time before we really realised the impact that this was going to have, obviously on the world, but on us. So initially there wasn't a whole lot of guidance that was coming through. It was coming through in stages, it was rapidly changing. And for us, we very quickly were looked upon to become the experts. It was a very daunting and frightening time for our colleagues, for our patients. And as the infection control team, we had to be quickly thinking on our feet and adopting the changes and the guidance to be able to give reassurance and advice to our staff to manage the situation. The priorities for us before the pandemic were very much around C. difficile infections, MRSA infections, and all sorts of other day-to-day infection control management, outbreaks of norovirus, winter infections, and the big challenge for us was still being able to manage that alongside this very new and emerging virus. So a massive challenge for all of us in the Trust.
During the COVID-19 pandemic, we have lost a number of our patients, and our colleagues have lost loved ones, friends and colleagues as well. So it was really a sad and difficult time for everyone. But as a Trust, we are coming together to make sure that everything we learned from those deaths and those experiences is something that we will use to continuously protect our staff and our patients.